Hi, it's Casey. Alright, well, today I'm going to get an ABG. So I want to obtain my equipment, and that's going to be the blood gas kit. That includes the syringe, the needle, the point lock, the alcohol swab, gauze. I need a biohazard baggie, but we don't have that today. And then I need a label. Okay. And then after I make sure I have all my equipment, I want to go into the chart and I want to review if there's an order for the ABG. I want to check if there's recent FiO2 changes or ventilator changes, and if there is, I want to make sure that I wait at least 10 minutes. But if the patient has a history of air trapping disease, then we want to wait at least 25 minutes. I also want to check history and check if there's any wrist trauma, if they have a dialysis shunt, or if they're on any anticoagulants. And then I want to look at their lab panel to make sure that they have they don't have prolonged clotting history of that. After that, I want to go into the room and I'll probably say hi to the patient, introduce myself as a respiratory therapy student. I will make sure that I wash my hands and put on my gloves, and as I'm doing this, I'll tell the patient what I'm here for. I'm here. Okay. Okay. And after I confirm and I tell the patient I'm getting a blood gas, that I'm going to choose the puncture site. I mean, if they had any, I'll choose their non-dominant hand if that's a good hand, if there's not any problems with that hand. So once I choose the site, puncture site, I want to make sure I do my test, my ALMS test, and I'm going to do it on Jess here. Make sure I do cut off, and I have her pump 5 times. I'm going to let go. Color coming back to her hand there. Lovely. Okay, and then I'm going, after I do that, I'm going to clean the site with my alcohol swab. I'm just going to clean right here, make sure I press hard enough to clean. Like so. I want to let that dry naturally before I go ahead and poke the patient. Then I'm going to get my needle, my syringe out, and make sure that it's pulled back to at least 1 milliliter and poke. And then I will make sure my gauze is open and have that placed on the patient's arm and ready to go. I'll also get out my stopper here. Okay. Now I want to make sure I palpate the patient, make sure I get a good pulse here. And this arm has a great pulse. So, and I want to make sure I do that with my non-dominant hand. Then I'm going to get ready and take the cap off. Make sure I have a good hand on here. I want to make sure I have the bevel up, and I'll angle it to at least 45 to 60 degrees. So, okay. I'm going to inform the patient before I stick it in their arm. I'm going to tell them that it's going to be a big pinch and let them know that, but I'm not going to tell them that until I'm about ready to stick in the needle. So, alright. Stick it in here, big pinch. There we go. There we go. And I will take it out and apply pressure for at least 5 minutes. But as I do that, I'm going to put my needle back into the point lock, like so. Can keep it there. And then I'm going to keep pressure on this for at least 5 minutes, and I want to take off, twist off this, so, and then put this into, and I'm going to keep pressure on this, or have my partner keep pressure, or have somebody help me. I want to make sure that I dispose of this in the needles container. Then I'm going to eject any bubbles and do this here. And I have a lot of bubbles, but I'm going to go ahead and press it up and get rid of those bubbles. I'm going to rock and roll it. Here we go. Then I want to put the label on the syringe, and I want to put the date, the time that the sample was drawn, and then the room number and the FiO2 on this. And then if the patient is on a ventilator, I want to note that like the respiratory rate, the minute volume, the peak peak, and the PEEP, and I want to insert this into a biohazard bag. And then if I want to label the biohazard bag, I can do that also. Then I want to make sure that the patient's doing okay, make sure that they're comfortable, and make sure that they're feeling okay. And then I want to analyze my sample here and put that into the chart.